Do you think that we will ever get to a future space? I guess it's just a speculation question where like you're recommended to get a colonoscopy at a certain age, or like you're recommended to get a prostate exam or something, where we will start to do cognitive testing for individuals as a baseline at a certain age, and possibly even biomarker testing at a certain age to, gather some of that information and maybe identify people earlier?
Yeah, so there's two steps in the diagnostic process, and you just hit them. The first is early detection of cognitive impairment, and the second is accurate diagnosis of pathology. That early detection of cognitive impairment should be happening today. The annual Medicare wellness visit actually requires that a cognitive assessment is done for all Medicare beneficiaries. So if you're 65 or over in the United States, you have a legislative right to have a cognitive assessment at your baseline. And it's really important to do it that way because your best measure is yourself and
Yeah.
change over time. Unfortunately, they are very, very rarely done in this country. Um, and even the acceptability of the doctor just kind of doing their own assessment is okay for the annual wellness visit. And, we all know that doesn't work with mild cognitive impairment, right? Doctors have 6 or 8 minutes with their patients. It's not accurate. So, unfortunately, currently the US Preventative Services Task Force does not recommend cognitive assessments. You're able to do it. They don't not recommend them, they just don't recommend them. That's something that needs to change. It's an inconsistency in our own legislative policy between the annual wellness visit and the USPSTF. But, I would love to see it at age 50, right? I mean, why wouldn't we be thinking about our brains? I mean, I don't go into the doctor and not get my blood pressure taken, or
Right.
my cholesterol taken or my fasting blood glucose taken, and I don't have any diabetes in my family. But I do have dementia in my family. Why aren't they testing my brain starting at age 50 every year? Just so that I know that everything's okay. And, now with technology and digital cognitive assessments, we're actually able to do those in a very standardized, validated way with task shifting to lower cost resources in the health setting. So honestly, that could and should be happening today. Blood tests, which is your accurate diagnosis, that's a little bit different.
Mhm.
The blood tests as they stand today are only validated with their cutoffs for people that have cognitive impairment.
Yeah.
So the way this works is a blood test has a certain sensitivity and specificity, but their positive and negative predictive values are based on what population they're used in. So you can imagine, right? You're going to have a higher positive predictive value in, say, a memory center than you are in the general population. So the cutoffs and the interpretation is really matters. These PPVs and NPVs really matter. And so they're only validated and essentially approved or recommended for use with people with cognitive impairment. So in terms of kind of screening with a blood test, I think it's possible in our future. And I think certainly if the preclinical AD studies, Trailblazer 3 for Kisunla and AHEAD 345 for Leqembi, I think if they hit, then yeah, I think we might be having to talk about blood tests because now you're talking about I need to find amyloid in people who aren't cognitively impaired. But today, the blood tests are really just for use for people with cognitive impairment for whom they would like to have that pathological diagnosis.
Outstanding. Well, I hope we do see that growth and that preventative,
I think
early
it could be in the next
diagnostic.
5 years.
Oh,
Absolutely.
I really hope we get there. I'm a big believer in, in the preventative annual wellness checkups to try to gather some of that baseline information. Because having dementia in my own family, that process of realizing that when people go in and they take those tests, that everybody comes in at a different space, right? They're everybody's cognition and cognitive capabilities are different, and we're all coming in with different spaces. And so what are we measuring against? What's the threshold? Because there's the concept of change, and then there's a concept of a number that says this is the number that if you go below this, there's a problem. But it would be lovely to identify that there's changes happening before somebody hits that number.
Yeah, there's a standardized normative database that almost all the tests use today, which is based on your age and demographics and things like that. But really, your best indicator is yourself. And that's what I'd like to see happening. And hopefully, it'll happen soon.